Assalamu alaikum. I'm Dr. Muhammad Mohsin. Today we are going to talk about one of the stations of communication skills under the name of angry patient. And as usual, the name of the station is regarding a summary of what you will find in the patient note inside the preparatory station. Actually, this type of communication skills, as we said before, it is some of the communication skills inside the station. So what does this station test here? It tests how to deal with angry patient, and it measures your ability to talk with such patients and how to control his anger without getting angry or fighting with him. So this is very important to know what is behind your task in such communication skills. Okay, so in this station, in the preparatory station, you will find in the patient note that this is an adult patient working as a postman. He had a knee joint trauma, and after clinical examination and MRI, he was diagnosed to have a meniscal injury. He was scheduled for knee arthroscopy to repair his meniscal tear. His surgery was postponed before because there was no time to complete the whole list. The patient was readmitted again, and today he is supposed to be operated upon, but unfortunately the responsible consultant was called out for an emergency. So the patient's surgery will be postponed for the second time. As you see, this is a difficult scenario for any doctor to deal with patient, and actually we face this scenario many times in our clinical practice. So what is your task here? Your task is first to talk to the patient. You will talk to the patient and inform him about this bad news. Second thing, you have to control his anger, or try to control his anger, because this is not important to convince him regarding your information. Just try to convince him and answering his questions. So the station, in this station, it is so important to know something about communication with such patient. This is regarding body language. As we said before, in an anxious patient, when the patient start to cry or to shout or something, you have to calm down and keep silent. So in this station, actually, if the actor is a professional one, it will be so difficult for you. Okay, because he will be very angry, and he will start to shout and make things tough for you. But as usual, you have to know how to deal with this situation. Okay, and even if, as I told you before, even if he started to shout and he continued to shout till the end of the station, and he is not convinced about your talk, this doesn't mean anything. This doesn't mean you have failed in this station. Just be professional and stick to the rules. Okay, reply on his questions in a professional way. Keep calm, don't get angry, don't fight with him. This is your task. Okay, but convincing him, whether he is convinced or not, this is not such an important issue here. So the station will start as usual. You will identify yourself. Good morning, Mr. X. My name is Dr. Muhammad Mohsin. I'm the orthopedic trainee covering for my consultant. He will start to say, hello doctor, yes, I'm ready. I know it's my turn now. I'm preparing my clothes now. Till now he doesn't know that his operation was cancelled or was postponed. So he is still calm. So you will start to throw the bomb in his face now. You will start to say, I understand that you have come today for your knee operation. He will reply, yes, I am here today for my scheduled knee operation. So you will start to say, I'm sorry, Mr. X. Unfortunately, my consultant has been called away for an emergency case, and we will be unable to carry out your case today. As in a previous station, when you break a bad news, the patient will try to express or the relative will try to express his feeling or her feeling. So in such a station, when you tell him that his operation was cancelled, he will be very angry. He will start to shout and then expressing his feeling. So as we said before, let him finishes and don't talk again until he calm down. He might stand up. This is so important point here. Okay, concentrate here. He might stand up. If he did so, keep sitting on your chair. Don't stand up. Don't stand up. This is a fatal mistake. Okay, don't stand up, because in body language, if the patient or the relative stand up and then you stand up, this in body language means you are going to fight. Okay, so keep silent, keep sitting, and ask him to have a seat. Okay, ask him to calm down. Please, Mr. X, calm down, have a seat, and I'll explain to you. So the actor will start to shout. As I said, he will start to say, what did you say? My operation was cancelled. How could it be? I can't believe it. Are you kidding me? This is the second time. Oh my God. What kind of hospital is that? Why me every time? No, it will not happen again. There must be a solution for that. I can't walk. I can't work. I can't sleep because of pain. I'll raise a complaint against this hospital. I thought this is a large hospital. How could it happen in such hospital? So as I said, he will get angry, and you keep calm and keep sitting until he finishes. Then start to say, Mr. X, calm down please and have a seat. Let me explain to you. Again, I do apologize. So you have to repeat apology here, and start to say again, I do apologize. I can see that your knee has been really troubling you. It have been better to do your surgery today. I understand your frustration, and I see from your notes that you were postponed once before. However, surgical emergency has a priority, and that's why my consultant was called away, and he had to leave the hospital in a hurry. I'm really sorry for that. So now what did you say here? You apologize, and then you understood his feeling and his expression. So you understand his feeling. Also, you explain to him the priority of surgeries, that emergency has some priority to elective surgery. And then you explain to him why the consultant didn't came to see him. Okay, because it should be the consultant who talk with this patient and explain to him. So he will start to say, please doctor, let me talk with your consultant, call him now. So the actor will take you in another question, that's talk to the consultant on phone. And now you told him that he left in hurry for an emergency. So you have to tell him, I'm sorry, as I told you, he is busy now with that emergency case and he will be unable to pick up my call. So he will start to say, okay, I want to change this consultant. I don't want him anymore. Let me contact another consultant to do the surgery for me today. So he asks about an operative procedure inside the hospital, which is changing consultant. And for your knowledge, inside the system of the NHS in UK, if the patient tried to change his consultant, he will start from the 0 point. Okay, so you have to tell him this situation. Okay, Mr. X, it's your right to choose your doctor, but I'm afraid that changing your doctor will be a time consuming, as the new consultant have to study your case from the beginning. So now you informed him about this information that you have to know. So the actor will say, okay, you know my case and you reviewed my notes and my investigation. You can do it. You can do the surgery for me today. So he will ask you a question about your job description. So you have to tell him politely, I'm sorry, but I'm not authorized to do such operation without supervision, because your role here is SSO, so you are not accounted for such jobs. Okay, now he will start to put much pressure on you. He will start to take some promise to schedule him in the next surgery list and to give him an accurate appointment. This is a big mistake if you did like so. If you told him, don't be worried, I will put you on the coming list or in the nearest list, or I will put your case as a priority in the list. Don't say like that. This is a mistake in this station. Okay, you shouldn't give him a certain appointment for surgery at once, because for now you don't know what is the surgical schedule is. Okay, you have to get back to this schedule and see if there is vacations, what kind of patient scheduled in coming list. So don't give him a priority, or don't give him certain appointment. So he will start to say, okay, then my operation was cancelled for me for the second time. I can't return to my work now. I need you to determine an appointment for me to come. You have to promise me it will not be happen again in the next list. Also, you have to promise that my surgery will not be cancelled again. See, he is continuing to put much pressure for that reason. So your answer should be, I'm sorry, I can't give you a surgical appointment right now. I have to check for an available date. We will call you back once there is available appointment. I can promise that I will mention your circumstances and emphasize the importance of having you listed in the soonest possible list. So now you told him very politely that you can't put him now on a schedule for surgery, and you have to return back to the surgical schedule, and you will mention his case in the notes. So what is coming, that the patient will not be convinced on such words. So he will start to say, but you didn't promise that my surgery wouldn't be cancelled again. As you see here, he start or he continued to put pressure upon you regarding this point. But in every time he repeat his question, or he repeat his request, don't give up. Don't give up to his pressures. Okay, you have to stick to this rule. I'm sorry, sir, but if such an emergency should raise again, it would be prioritized. So this is very important. Okay, say it frankly. If there is emergency, the emergency has priority to the list. All of us know this in our daily practice, that elective list can be postponed, but emergency can't. So the actor will start to say, I'm now out of my work for more than a month. My sick leave about to finish, and I can't return to work with this condition. As a postman, I can't walk, and my employer will get angry with me. See, he takes you now to another issue, which is work problem. And as a doctor, you have to try to solve this kind of issues to the patient. So you'll tell him, okay, I can write a letter to your employer explaining your need to extend your sick leave, as your procedure was postponed, and you will not be able to carry out your job as a postman for now. Even I can call him and talk to him personally if you want. So now you succeeded to control his anger regarding this point, and you offered a solution for his problem. Then he will start to say, okay, you know I have a meniscal tear. If I walk normally on my legs till the time of surgery, will it be a problem? Now he asks about a clinical question. And as we know, meniscal tear may be causing some pain to the patient, may cause some discomfort to the patient, but it isn't much problem if the patient continue to do some walking without hard exercises. So you will tell him, well, there will be some wearing and tearing. However, you should remain active with non-bearing exercises such as swimming to keep the strength of muscles around your knee. So now you didn't inform him to do some hard exercises, but you told him to just do slight exercises to keep the strength of the muscles around his knee. Also, you have to say, I can refer you to a physiotherapist who will recommend some good exercises to strengthen the knee. So you explained your answer to him regarding his question. Then he will start to say, okay, that's good, but I have another problem. You prescribed me diclofenac sodium for a long time, but I have heartburn and pain in my tummy. What shall I do? Now he complains from a side effect of non-steroidal. So you simply you can say you should stop diclofenac now as it increases the risk of stomach ulcer. I will prescribe for you a different type of painkiller. So now you answered his question regarding non-steroidal. Then he will start to say, okay, so I will leave the hospital now and you will call me later on. So you'll say yes. Do you have any more questions? He will say no. So again, accept my apology and thank you. So as I told you before, in this station, sometimes it may not end like that. Okay, the patient may continue to shout and raise his voice, maybe continue to get angry with you and continue to say some things like he is not satisfied about the hospital, about the service. And as I told you, don't be afraid of this situation. Just keep calm, keep stick to the rules, and don't get angry with him, and it will be a very nice station for you. I hope this was beneficial for your preparation to exam. Good luck and thank you.